Hi and welcome. Today we are going to talk about suicide. Suicide is a complete act of killing oneself, which is viewed as the best way out of a problem or a crisis that is invariably causing intense suffering. Suicide is actually associated with unfulfilled needs, feelings of hopelessness, ambivalent conflicts, unbearable stress, or a narrowing perspective of options, and a need for escape. Attempting suicide, on the other hand, is an attempt to kill oneself, which is consciously planned and considered as the best solution for their problems, but the person does not die. So it is an complete act. Injuries may or may not occur. Parasuicide is threatening acts of killing oneself with no intention of death. It may lead to accidental death. Most parasuicide attempts involve delicately cutting. In majority of cases, it's usually a cry for help. Usually, it occurs in individuals in their 20s, and alcohol and substance abuse is common among these people, and some of them claim not to experience pain. What are the risk factors for suicide? You can recall this by using the third person skill. S stands for sex. The male to female ratio when it comes to suicide is 4:1. However, females attempt suicide more. A stands for age. Suicide is more common in people less than 20 years old and greater than 45 years old. For men, the rates peaked at 45 years old. For women, the rates peak at 55 years old. D is for depression. Previous suicide attempt is the best indicator for another suicide attempt. A history of suicide or attempted suicide in the family, including anniversary suicide, is also a risk factor. The risk for suicide is highest within 3 months of the first attempt. E stands for ethanol use, alcohol use, or drug used. R stands for rational thinking loss, which can also be called psychosis. S stands for social support, which is lacking, or social isolation. Poor personal family relationships can lead to social isolation. O stands for an obvious and an organized suicide plan. Here you'll have a thought, an idea, a plan, and a suicide note. N stands for a nil significant other. Marriage, which is reinforced with children, usually reduces the risk for suicide. Rates in previously married people are higher than the rates in single people. Previous married people are divorced people, separated people, and widowed people. S stands for sickness or bad physical health. There is markedly increased rates of suicide in people with severe burns, with disfigurement, especially in women, and loss of mobility, especially in men, which can occur in spinal injuries or in some cancers. Others include race, where whites commit suicide more than black people. Rates are also higher among immigrants than among natives. Religion, where the rates are lower in Roman Catholics than in Protestants and Jews. Employment or work, where employment seems to reduce the suicide risk. Jobless people commit suicide more than employed people. Others include factors such as occupation, where the higher the social status, the higher the risk for suicide, but also a fall in social status increases the risk of suicide. People such as people in the medical industry, lawyers, law enforcement officers, insurance agents, musicians, and actors are at an increased risk of suicide. The etiology of suicide may be biologic, where it might be an illness such as major depressive disorder or even a physical illness. It might be due to decreased serotonin levels. It might be due to genetics, where suicide runs in some families. It might be due to psychological factors such as the stress diathesis model, where a person who is vulnerable is acted upon by a stressful factor, allowing the person to commit suicide. It might be psychodynamic, where suicide is an aggression towards self or towards others that is turned inward. It might be also due to a cognitive model of depression. It might be due to social factors such as lack of social support or stressful situations, among others. Management of a suicide patient. The first step is first aid. This can be done as an outpatient or an inpatient, depending on the method used to attempt suicide and also depending on the extent of injuries. Also, a medical practitioner should not ignore suicidal ideas in outpatients and should also assess for high-risk groups. The second step is admission, What are some of the indications for admission? Lack of a strong social support, a suicide plan of action, great extent of injuries, an unconscious patient, a patient who's been threatening to commit suicide then goes quiet suddenly, or an underlying medical or physical disorder, among others. Once a patient Inpatient management includes constant observation and recording of those observations, usually done by a psychiatric nurse. Searching of people's belongings. Electroconvulsive therapy is considered. Supportive psychotherapy is also offered, where most of these people are going through a crisis. Some of the problems have solutions where you can try to help the people solve the problem. For example, a way to pay school fees for their children. Some problems have no solution, where you can teach coping mechanisms. Or some problems might have an easy solution, such as a boyfriend or a girlfriend causing problems, where you might advise the patient to run away from the girlfriend or the boyfriend.